Hi, I'm Laura Mize, pediatric speech-language pathologist, and welcome to this special CEU presentation from teachmetotalk.com. Now, not a day goes by when I don't receive an email from a therapist saying something like, how can I know that a child has a language delay and doesn't have anything more serious going on like autism? As therapists treating toddlers in state birth to 3 programs or even working in a preschool setting in a public school, we often find ourselves working with a new little friend and we are waffling. We are seriously going back and forth, wondering, does this child just have a language delay or could it be autism? Now, this happens most often when a child has gotten some initial success, especially when it's with us, especially when during that first few sessions, maybe we've taught him some new words and he's talking now and his parents are very, very excited about his progress, and so are you. This might also be a kid who has some fantastic cognitive strengths. He may have an outstanding memory, like he remembers where a toy was kept or where you retrieved a toy from in your very first session, and this is several sessions later. Or he might have some really pretty impressive pre-academic skills like early letter and number recognition, or he's doing something very, very technical, like he can operate the iPad better than you. And so with those kinds of kids, we really say things like, there's no way this can be autism, he's so smart, or there's no way this can be autism because he's just made such good progress, he's so quickly picking this up. But at the same time, with those same kids, there's still some things that we might casually refer to as quirks or little idiosyncrasies with those same kids. And when this happens, we go back and forth. On good days, especially on those sessions where we have really rocked it and we think, man, oh, this went great. I just had a great plan. This kid's responding so well. Or we think this child is pretty connected today. On those days, we think there is no way this child has autism. There's no way anybody would ever give him this diagnosis. His issues aren't that severe. But then what happens? He has a really bad day. He starts to stem a little bit, or you notice just there's some little things. You see some maybe things like toe walking that you haven't seen before, or maybe his behavior is just really off. It's hard to keep him on track, or he's overly reactive to things with you. And now you're going, wait a minute, I'm not so sure. This has to be more than a language delay. So this little dance may go back and forth with you for weeks or even months as you sit there and really think about it. You may not share this indecision of yours with anybody. You may not even talk about it with a colleague. You're certainly probably not documenting these things, and you certainly aren't talking to a child's parents about that because you don't want them to know that you aren't really sure what's going on with their child, and you might think that that would erode their confidence in you as a professional. It's just there in your gut saying, I don't know. Another tricky aspect of differentiating autism from language delay early on is the initial information we get from the person who referred the child for services. So here's what usually happens. Parents usually have the very same first concern about a child, no matter what the reason is or what the diagnosis turns out to be. They usually say some version of, my child isn't talking yet. And so we're only thinking from that statement about the expressive language piece. Now, this holds true with referrals from other sources beyond parents, and it may provide little information, again, beyond something like speech delay, which is what pediatricians often write on their referral paperwork. And most of the time, they haven't even mentioned anything to a parent beyond he's not talking yet. So no one else is looking at anything besides expressive language delay or, again, late talking. Now, on a little side note, just so you know, according to ASHA, delayed onset of language is the #1 reason that toddlers receive early intervention services and preschool special education services in the United States. So even from the time of the initial referral, getting that accurate read for any young child with any kind of developmental delay can be super tricky, but especially for kids who are still still in that birth to 3 age group. So the younger the child is, the more difficulty we will have getting a real definitive read on what's going on. Now, one of the most important reasons for that is that there's a wide range of what's normal for toddlers, and that's just in every developmental domain, not just language. So let's look at something beyond language. Let's just take an example from motor skills. Now, most babies begin to take their first steps when? Usually right before or right after their first birthdays. But the actual age range for normal walking can occur as early as 9 months or as late as 18 months. So that to me is a really big age range there. Now, if you're a parent, you may think, well, what's the big deal? They can be early or they can be late or whatever. But as a therapist, that 9-month gap is a tremendous amount of time, and it could actually be half of a kid's life if it gets to 18 months old. So look at that and look at that variability. And that's what we are thinking about when we're looking at language development too. There's a wide range of normal for toddlers. For example, a 24-month-old can say 50 words and be normal or have typical language development, but they can also say 300 words and be considered in that typical or average range. So that's why so many people, even we as professionals, say things like, every child is different. Now that's true, but that statement can also be really problematic. I want to provide you with what I think is a pretty convincing counter argument to this commonly used statement. Our acceptance and expectation of individuality or individualism or variability in how and when toddlers master language may cause us to overlook some pretty big red flags developmentally in our youngest clients. So we may expect a kid, again, to follow his own kind of trajectory or think that that's what it is, and then miss something that's really important diagnostically when we are evaluating that child. Once kids do go on to be diagnosed with autism down the line, sometimes we get early intervention as the very first person who saw that kid may kind of beat ourselves up a little bit. We may think things like, I wish I had known for sure sooner. I wish I had paid attention to that gut feeling that I had. I wish I had said something to his parents. I wish I had mentioned it. We, as busy practicing therapists, need some simple guidelines that are pretty easy to spot so that we can recognize early on what's truly beyond a language delay. We need a list of really practical but concrete, observable criteria to help us decide that a toddler is likely to get an autism diagnosis or should be referred for further testing, and that what we are seeing goes beyond the realm of language delay. Now, this criteria should also be simple enough for us to observe it in a really short amount of time in our very first session. It should also be simple enough that we can even get it before we see the kids, so maybe in a list of questions in a short parental interview, maybe even over the phone that we're asking parents or that we're asking preschool teachers or other people who are highly involved with the toddlers that we're seeing, even before we start to conduct that official assessment. Now remember, our primary objective here is the same as with any screening tool that we might use. It's just to separate kids into two categories. Those kids who have red flags for autism, and again, our purpose for that initially is so that we might refer them for further testing. We want to differentiate those kids from toddlers who we just really know have just a language delay. We don't need to refer them on for additional testing, and that we're just going to handle that with therapy. Now, there's been extensive research in how kids with autism differ from children who are typically developing. But many of us therapists, even those of us who have worked for a long time, who have considerable experience, may still struggle with this for kids on our caseloads. Now, why is that? Well, usually from a practical standpoint, it's because we hang out with delayed kids all day long. We almost expect everybody to have delays, or we do. That's the reason we're seeing them. If there's not something going on with their language development, why would they have been referred in the first place, or why would we have qualified them? How would they have met that eligibility requirement? So that's one of the reasons. The second one is that most of the time these things overlap. Kids with autism do some of the same things that kids with language delay do. So we need a way to kind of separate those kids, again, so that we really, really know. And the earlier the better, especially when they're toddlers. And again, if you struggle, frankly, that's most of us. Don't beat yourself up over that. And I can help you with this. And that's the purpose of this whole course. Here we're going to review the main areas that differentiate ASD from other developmental problems, and that would certainly include language delay. Now, this information is evidence-based. So what does that mean? That means you can trust it. This is not just my opinion about this or my own experience. I've gathered findings from several sources that are listed in the handout that you'll get, including the research from Mitchell. Now, this is a retrospective study, which means that they've pulled findings from lots of different projects to come up with this information. There's a great section about this at ASHA's practice portal. Now, I've mentioned ASHA twice now, and let me explain this acronym for those of you who are not speech-language pathologists. ASHA stands for the American Speech, Language, and Hearing Association, and that's the credentialing body for speech-language pathologists here in the United States. And this information is on their website, which is asha.org, and you can access just a wealth of very practical information for clinicians. You can search almost any diagnosis and get all kinds of recommendation from assessment all the way through intervention. So it's just an amazing resource, and you'll find the link for that organization's website there in your course material. Now, this information from today's course is there in their section on autism and early identification of autism. So if you are particularly a speech-language pathologist, you need to go check that out. Now, why is this information important? Or why should it be important to you as a therapist? Differentiating toddlers with autism from toddlers with other kinds of language delays as early as possible is so important as we plan their intervention strategies, because we have to tailor what we are doing in therapy to address their specific core deficits. Kids with autism have different core deficits than children with other language delays. And if we are just looking at that expressive piece, we're going to miss something, and our treatment plan will not be nearly as comprehensive. Even when a toddler doesn't yet have a firm diagnosis of autism, we still need to be sure that we are addressing those core issues, again, so that we can treat what's really, really going on, or the reason that the child isn't really communicating. This is especially important when parents are not on board with further testing, or when they don't even want to hear you say anything beyond language delay or speech-language delay. That's been serious enough for them, and they are just not ready to process from an emotional perspective anything beyond that kind of initial impression from you. But we do have to be sure that we as therapists are targeting a child's core deficits with really highly specific individual interventions that we design. Now, if we only look at that expressive piece, we're going to be in a lot of trouble. And that's what we do essentially when a child is only a late talker or when there's only an expressive language delay. If we do that with kids with autism, we are missing the very important reasons, like I've already said, that he's not communicating. So a kid may not make any progress, or he may develop some splinter skills, or have that really uneven pattern of development. And again, that's super, super confusing. And for us as therapists, we get confused about that too. But really it all hinges on we don't have an accurate working diagnosis for that child. So if we're only looking at that expressive piece, it's not going to be enough to make a significant impact with a child with autism. On the other hand, interventions that are most effective for children with autism will be completely unnecessary for a child who's a late talker or a kid with just even a mixed receptive expressive language delay. So again, we have to be super, super careful. The bottom line is this: when we don't know what's going on, our interventions won't be as effective for either group. We're either providing too much or too little, and we don't want to be in either of those positions. Let's look at another critical consideration before we take a look at that criteria. Remember that autism includes not only an absence of typical behaviors, but the presence of atypical behaviors. Now let me say that again in case you've missed that, in case you drifted off a little bit. Autism includes not only the absence of what we expect to see, but the presence of things that we don't expect to see, things that surprise us, things that are dramatically different from children with typical patterns of development, and again, even from children who have language delays. We don't see as many of those extra things or things that we didn't expect to see, or the presence of atypical behaviors in children with language delays. We just see that things are missing, not those extra things that really make us stop and think, what was that? It helps to think about the things that we observe in children in this way. Am I expecting to see something that's not present, which again is a missing milestone? Or is this something that I don't expect to see that's an atypical behavior? And we'll talk about that as we go through our list of criteria. Now, I need to also caution you here to think about quality and quantity as we're looking at our list. Just because a child has exhibited a behavior or a milestone one or two times certainly does not mean that he has mastered that skill, or on the other hand, that something is even a real problem for him. We have to look for overall patterns of behavior, not just isolated instances. And that's especially true. The younger the child is, the more often we need to be looking for patterns. Now, we're looking for consistency here. So before we credit a milestone as attained or mastered, we need to make sure it's a skill that he actually does own, as I like to say. Now, to borrow a line from speech-language pathologist Dr. James McDonald, we want to see a child with skills that are strong and stable, not hit and miss. Now, the hit and miss part is my line because that makes a lot of sense to parents when we explain it in this way. Now, this is the number one reason that parents seem to gloss over or miss a child's delays. When they're looking at checklists on the internet, or when they're sitting with you during an evaluation, they don't think about consistency and patterns when you're asking them questions. You'll say, does he wave bye-bye? And if a child did it one time 3 months ago and hasn't done it again, a parent may still say yes. So we have to be sure that we're talking about quality. That same kind of question with a parent, we may say, does a child wave bye-bye? And a child is stimming with his hand in front of his face, and somehow a parent thinks that he's been waving, or they attribute that action every single time to waving. They think that's a gesture, and they don't recognize that as a self-stimulatory behavior. And so again, that would be a quality issue. So we have to think about these things when we're asking parents questions. It's up to us as professionals to help parents make those really important distinctions so that we understand exactly what's going on with their child. Now that we've covered those preliminary considerations, let's get on to the specific criteria that help you differentiate children with autism, or red flags for autism, versus children with language delays. Now, differences can be distinguished in these main areas: a child's social skills, communication and language development, motor differences, and other behaviors. These other behaviors cluster around atypical object use. There's also another behavioral piece that researchers categorize as temperament, but I like to think about this as emotional regulation. So we'll talk about all these different categories. Let's dive in and start with the first area, which is social skills. Now, what does social skills mean? What is a social skill? It means how kids interact, or most likely don't interact with other people. Here we're wanting to see very specific and concrete measurable skills like eye contact, like joint attention. So let's talk about these things. Now, of course, most people don't struggle with understanding what eye contact means. It means that a child is looking at your eyes. They are looking eye to eye and really face to face with you, and they do that persistently. It's not just a hit or miss thing. What is joint attention? Now, that's a little harder for us sometimes as professionals to explain to parents. Joint attention means that we're actually sharing an experience. The child knows and cares that we are there. He is interacting with us. He attends and he shifts his focus from what he's doing here back up to you. And that's how I like to explain that to parents. Now, joint attention is the foundation for communicating. And we have to be sure that children really have firmly mastered this skill. Communicating always involves two people. So when we have children that are just focused on what they are doing to the exclusion of everything going on around them, it's very unlikely that they are going to initiate and respond when someone else tries to communicate with them or talk with them. So we have to be super, super careful about identifying joint attention. Now, one of the most important instances or examples of an early social skill is how a child responds to his or her own name. Now, children with autism, especially toddlers with autism, have so much difficulty learning how to consistently respond to their own names. And again, this seems to be outside their general ability to process and understand language, or outside their receptive language performance. Now, why is this significant? It's because it's so different from what's normal. Typically, developing babies begin to alert to their names so early, between 4 and 6 months. And then children really respond very quickly and very consistently to their own names around their first birthdays. So when we see a child who is 18 months, 24 months, and not consistently responding to his name, that should be a big red flag to you that autism is a real possibility for that child. In my own practice as a pediatric speech-language pathologist who specializes in toddlers, this has become a big, big marker for me. It's so important that it's one of the first questions I ask a parent. And here's how I word it. I say, how does he listen when you call his name? And that's usually a big indicator, because if you say to parents, does he respond to his name? They may say yes, again, thinking that he did it a couple of months ago, 1 or 2 times, not the daily struggle. But if you change it and say, does he listen when you call his name? Does he come to you? Does he look at you? You're going to get a much more honest and realistic answer. Now, not responding to their names is one of the most common issues with toddlers with autism, or even children who haven't been diagnosed yet. But again, it's a big red flag. So if you have a child on your caseload who's struggling with this, especially after you've worked on it for a little while, think about autism as a real possibility for that child. Now, another distinguishing characteristic here within the social skills realm is social referencing. Now, if you're not a therapist, you probably have no idea what this means. But this is when a child looks at a parent just to check in, and it's all done through eye contact and eye gaze. And this isn't something that they're physically doing, like if a parent were here, I'm the child and here's the parent, and I'm clinging to her, or I'm rubbing her hair, or I'm seeking some kind of physical comfort. That's not what we mean by social referencing. Again, social referencing is done with eye contact. And so kids here who have typically developing social referencing will look at a parent as if to say, is this okay? Let's say they're trying to play with a toy and they're not sure if that's off limits or not, and so they're looking at their parent for confirmation. Or it might even be something, again, within that joint attention experience. They're looking at a parent like, did you see that? When something is exciting or a surprise to them. And again, this indicates that they're really, really sharing that experience. So let's highlight the difference here within the social skill category. Kids with autism will always have more marked difficulty in social engagement, because that's one of the core deficits of autism. That's one of the identifying features. We're not going to see social skill issues, or those things, problems with eye contact, problems with social referencing, problems with joint attention, to the same degree in children with language delay as we will in kids who go on to be diagnosed with autism. Kids with language delays are connected to other people. They do consistently respond. They recognize and they know their own names. And more importantly, they are constantly, usually, seeking out interaction with others for purely social purposes. So they like just hanging out with other people. They're not self-isolating to the degree that we see our little friends with red flags for autism do. So kids with language delays not only respond to eye contact, they use it. It's one of their primary modes of communicating. And actually, another important factor here with eye contact and eye gaze is that as toddlers develop between the first birthday and the second birthday, these things actually strengthen. They get better, and they actually use eye contact, like we were talking about before, to just overtly and obviously communicate with other people. And our little friends who are on the spectrum will not. So let me interject one more thing here. Social smiling, or smiling to you or at you, or as they are walking around the room here is not a determining factor. Research has confirmed that this is not a significant difference. Social smiling is not different in kids with autism versus kids with other kinds of language delays, or even children with typically developing skills. Kids with ASD smile at other people, especially their parents, especially their siblings, and other people who are good with kids, like you. Like, I hope you're good with kids. You absolutely cannot use social smiling as a marker for the presence or absence of a social skill deficit, and lots of therapists mistakenly do. And you have to also think about quantity and quality here as well. You want consistent eye contact. You want consistent joint attention. You need lots and lots of examples of solid social interaction and connection during a day, not just when an adult works super hard to get their attention. So again, you're going to have to be looking at how children relate to other people outside of the therapy environment. You are good with kids. You know how to get kids pulled in to connect with you. So you cannot really gauge how a child does with you and really apply that to his generalized social skill ability. So to summarize, kids with autism will have lots and lots of difficulties, and they have consistent difficulties with social interaction. Kids with other speech language delays do not. They are socially connected. The second area of development that we're going to look at is communication, or their language skills. Now, this does not necessarily mean vocabulary size, and do not get fooled by this, because lots of kids with ASD, even as toddlers, talk, but they don't communicate. And that's the line that we need to really hold in our minds as we're thinking about these kinds of kids. Now, communication includes how children respond to you when you speak to them, not just what they say. Now, we usually think about this again as receptive language, or how kids understand language and follow directions. But we're also thinking about just general responsiveness to interaction and conversation with other people. Now, this also includes how children initiate, or how they let you know what they need. So how does a child use the words he has? Can he ask for things? Can he answer questions? Or are all of his words strictly limited to a labeling kind of context? And we'll see that a lot in children with autism. I've seen kids with 200 or 300 words, and of course they don't qualify for lots of state early intervention services, because lots of times that initial screening is just based on vocabulary size. So that's a real disservice to children. So be sure that you're looking at their pragmatics, or how they actually use their language. So this is why those kinds of questions, like how many words does a child use, isn't really representative of what's going on with their communication skill development. Many times children with autism are nonverbal. And so as a parent, if you're listening to this and you're thinking, well, my kid doesn't have autism because he's not even talking, don't misunderstand what I'm saying. I'm just trying to say that lots of children with autism do have words. They're just not using them in a very communicative way. A big distinction, again, is hold on to that line. This child is talking, but he's not communicating. Now, in kids who are verbal with autism, we'll see the things that we talked about before. It's not that they're just missing skills. They have some atypical skills that are present in their repertoire of vocalizations. So things like echolalia. Now, if you're a therapist, you know what that means. But, this is on YouTube. So parents and every other person in the universe can watch this. So echolalia means that a child parrots or just repeats words or sentences, or even entire paragraphs that he's previously heard without any real context. So this might be a child who quotes a book that he's memorized, or a child who can quote a whole entire section from a movie or a television show that he really likes. These are kids who pick up repetitive phrases, and they use them even when they're not appropriate. They may repeat something that you say all the time, and at the beginning it's cute. It may even be funny. And again, hopefully we can steer some of those little lines and make them really, really functional or really usable. But lots of times they're not. And so when we hear a lot of that repetitive speech, that's echolalia, and that, again, is the presence of an atypical behavior. We may also hear lots of rote language. And again, these are things that they've memorized that sound really advanced compared to where a child is functioning in his everyday life. For example, a kid may be able to recite the entire alphabet, or sing a song like Happy Birthday, or count to 100, things that are really, really rote and memorized, when he can't follow very simple directions like go find your shoes, or where's your cup? Or he might name, 7 or 8 colors, or know names of lots of different shapes, but can't follow those really early basic directions. He's not able to point to body parts or things like that, things that you would really, really expect. So there's a real difference in their kind of academic sounding language versus what they're doing in a real practical everyday setting. There may also be some other atypical vocalizations. So a kid may hum, or may have other kinds of unusual vocalizations and noises, things again that make you kind of go, what was that? We may also hear excessive jargon that's not directed toward anyone. Now, what's jargon? Jargon are those long strings of unintelligible speech. You know that a kid is trying to talk, but you have no idea what he's saying. And again, lots of times jargon can be directed to someone, and that's still we still see that in children with typical language development, but when jargon appears to be very internally or intrinsically directed, meaning that a child just walks around kind of jabbering and he's not really looking at anyone, he's not directing that to anyone, that's the kicker here. He's using jargon, but again, is not serving a communicative purpose. Here we're also within this whole communication skill development realm here, we're also looking at nonverbal communication. This is how kids understand and use gestures, facial expressions, and body language. So these are things like waving, skills like pointing, and this again encompasses both pieces. How do they understand gestures, or kind of the receptive piece, and then how do they use gestures, which would be the expressive part. Now, receptively is usually a little harder to identify than the expressive piece. So how does a child understand gestures? Does he look when other people point? Is he following that point? Does he learn to read another person's body language? Does he know that he's in trouble by how his mom is glaring at him? Does he recognize when his little sister is upset and when she needs comfort? Now, toddlers with typical development, and even toddlers with pretty significant language delays, will recognize those things. They get it when their parents are upset and mad because they can just read it on their parents' faces. So really, really pay attention to those kinds of things. Kids with autism ignore a lot of nonverbal communication messages, and kids with language delays do not. Now let's move on to this expressive difficulty with nonverbal communication. Kids with autism, just like if they're not really paying attention or understanding or noticing when someone uses gestures and nonverbal communication to them, how well do you think they're going to learn to use it themselves? They have a hard time learning gestures, and it may take you as their therapist a long time to teach them to point or to wave spontaneously without lots and lots of cues. They may even have trouble learning how to shake their heads yes and no. So the research is pretty clear with how predictive early gesture acquisition is for language development. And that, again, is going to give us a big clue as to what's going on diagnostically with a child. Using gestures is a very big area that separates children, especially toddlers with ASD, from those who have other kinds of language delays. And if that is all you take away from this course, this is good. That's what I want you to hold on to. That's a big factor to help you determine kids who have red flags with autism versus when it's just a regular language delay. Lots of our kids with language delays use gestures as a way to compensate for their lack of words. So some children I've worked with in my 25-year career have ingeniously used gestures, and they've created elaborate signs for their parents to interpret, and their parents recognize those as very specific messages. Now, kids in both groups, kids with autism or red flags for autism and children with just language delays, obviously are all going to have expressive language delays. I mean, for goodness sake, that's why you're seeing them. As a therapist, you would not see them if we didn't have probably expressive language. There's some differences there. Parents probably would not have referred that child. But remember, lots of kids with autism have a completely unexpected profile. Their expressive skills are actually higher than their receptive skills. And again, just in case you've drifted off again with this YouTube video, let me say that so you can process it this time. Their expressive skills are higher than their receptive language skills. And this pattern is opposite of what we see in children with typical language development. Typically developing toddlers understand much more than they can say. And this profile is also noted in children with language delays. Usually their receptive language skills, or what they understand, is a lot better or at a higher age level than what they can say or what they can produce. So their receptive skills exceed their expressive skills. They understand, again, a lot more than they can say. So anytime we're analyzing test results and we see that pattern that's completely unexpected, with expressive skills at a higher age range than the receptive skills, we should think about autism for those kids. So to finish up with this language development section, remember what we talked about before. Anytime we see a skill that's missing, we're going to tend to think, okay, that falls more on the language delay side, versus skills when we see a child who has some atypical skills that are present. And kids with language delays, again, we're looking for, usually see those missing things, and it's opposite in kids with autism. When we see echolalia, when we see lots of rote language, when we see other things that are verbalizations that are considered self-stimulatory like humming, autism is the more likely diagnosis. Now we're ready for our third area. We're going to be talking about motor differences. Now, kids with autism may have lower scores in the motor section on standardized tests, but as a group, the biggest motor differences are things like body posturing and repetitive movements with your body. Now, this falls into the category of things that we see that we don't expect to see. So the presence of atypical behaviors. Now, let me explain body posturing for those of you who are not therapists or who may not be familiar with that terminology. Think about kids who do different things with their entire body. So these would be like I'm doing right now. Kids who sway, kids who rock, or it might even be kids who tense their little bodies, their whole little bodies when they get super excited. Or it might be kids that hold their arms or hold their legs in really fixed positions. Body posturing abnormalities also include things like toe walking. And let's think about the other piece of that. This would be repetitive movement. So things like hand flapping or finger rolling or wrist rolling. It can be also something more subtle with maybe a kid who's just really picking at his skin repetitively, or just any kind of repetitive movement that you see. Now, unless there's a global developmental delay, kids with language delays are just going to have no issues with motor skills, and we're certainly not going to see things like body posturing or repetitive movements like we do with children who have red flags for ASD. So when we do see motor issues with our friends with language delays, it's just the missing milestone piece, or things that we expect to see but don't. We're not going to see those atypical behaviors, again, like we do with those children who have red flags for autism. Okay. Now, the next area that we look at is classified as other behaviors, and these typically center around atypical object use. The official definition here is non-functional manipulation with objects. So let's look at an example. As a therapist, you probably see this all the time if you work with kids with autism. So what would a child do with a toy like a train? So when a kid has or let's start with typical. When a kid has typical object use with the train, what would we expect him to do? He would push the train, roll the train on the tracks, or maybe even, like if he were here with me, roll the train on the table, roll it on the leg of the table here. When kids have atypical object use, they're doing things completely different. These are the kids that have the train and they are just right down on top of it, or they are really hyper-focused on watching the wheels of the train. And so again, that's something that we don't expect to see. Other common examples would be children who are obsessed with opening and closing drawers and doors, kids who repetitively turn on and off light switches, or it might even be with a toy, a kid who is just stuck on excessive button pushing interacting with the toy. It might be a kid who repetitively throws things or drops things. That's his main way of interacting or using objects. It might just be a kid who has to fidget with something, who has to hold something all the time and really, really handle it. So those would be examples of atypical object use. Now again, this may also be paired with unusual patterns of visual exploration. Now if you're a therapist, you know what that means. They're doing different things with their eyes, or they're looking at things. Now, I already jumped ahead and gave you that example of the children who were just right down on top of the train watching the wheels spin. But this also might be kids who hold things at different angles to inspect. So if a child were here with me, she might take my clicker here and hold it up to the light and really want to check it out for a long time beyond what you would typically expect to see with a toddler. If they're watching TV, let's say you go into their homes and they are just plastered against the big screen TV, or it might be a child with an iPad who does this a lot, who's right down there, or who's picking up the tablet or the phone to really, really get it as close as they can. So all toddlers may do this kind of behavior from time to time, but again, you're looking at that overall pattern. Does a kid seem to get stuck in this visual lockdown, as I call it, often many, many times a day? And then even more important, beyond that, more importantly, how easy is it for you to pull him out of that or help him move on to something different? So when a kid has real difficulties with that, and when you see it day after day after day after day, those kids are more likely to be have autism than they are just typical language delay, or certainly typical language development, but just a more common language delay. Now, it's also a red flag, since we're talking about atypical object use, anytime a child is over the age of, say, 15 to 18 months and does not seem to know what to do with a really familiar object like a brush or a cup or even a phone or something that he sees used in his home every day. When a child doesn't show true pretending with objects by 24 months, we also know that this falls under this category of atypical object use. So when you have a child who can't or won't feed a baby doll, or who again won't brush a doll's hair, or doesn't seem to know that shoes go on the doll's feet, that's a real red marker for atypical object use too. Now, many times, parents of toddlers who go on to be diagnosed with autism will report something like, well, my child doesn't play with toys, or my child doesn't like to play with toys. And that is almost never the real problem. The problem is the child doesn't know how to play with toys. So again, this would fall in that atypical object use category. So interest and certainly individual preferences can also play a role here, but there's usually a skill deficit too. So to summarize this area, when atypical object use is a pattern, or when there are unusual or extended periods of visual exploration, and when play skills are missing or absent or weak, we suspect autism. So look at that. Kids with language delays are not going to have as much difficulty in this area. Kids with autism will have unusual fascinations too, or obsessions with objects, much more so than kids with language delays. So you can always use that as an indicator too. Now let's talk about this last area. Researchers call it temperament, but again, I told you that I think about it more in terms of emotional regulation. There are no studies that compare kids with ASD versus kids with language delay in this area, but there are some important differences that are noted anecdotally, and also we are going to just pull information from kids with typical language development. So the first one here is unstable attention. Now, what does that mean? That means that you will see periods of prolonged attention when it's something that a child is really, really interested in. And again, it's usually within that visual realm. So let's say a kid can play a game on his iPad for 2 hours. And he's fine. He is right there with it, and he is staying with it, and nothing can move him from that, which again is also an unusual or unstable attention pattern for a toddler. Versus you compare this same kid who can stick with that for 2 hours to how he interacts with you when you try to get him to play with a toy. Forget it. He is out of there. He avoids that like the plague, or his attention is just, 30 seconds and then he bolts on to something else. So again, when we see these big differences in a child's attention span, that's usually a marker for autism. And the next one is increased distractibility. Now, I usually think about this as related to sensory processing. This is when kids are not able to filter out incoming information as other children do. But these are kids who just can get off what you want them to, off track, off topic, whatever it happens to be, really, really easily. So let's say they might be just highly distracted by the buzz from the computer in the background that you can barely hear, or they hear the microwave ding in the other room and the sound is so faint, but that's so distractible to them. Or they might see just a little piece of fuzz blowing from the vent on the floor, and that just completely gets them off track. So that's a big, big indicator too for autism versus a child who has a language delay. The next one is so important. It's called atypical reactivity. So this means either extreme. Either a child is really, really flat. And do you know what I mean by flat? That means, expressionless. So it doesn't matter how hard you try, or if you are breaking out into a sweat to get that kid really into whatever you're doing, they stay pretty stoic. We think about that usually in terms of low arousal. So that's one extreme. No matter what's going on, they seem pretty unmoved or unfazed. Let's go on to the other extreme, which would be kids who are super, super sensitive. These are kids who are overly responsive. They have extreme distress reactions. These children are set off super, super easily, and then it's really hard to get them to calm down. So a parent may say something like, "Please don't take that toy away from him because it is going to take 2 hours to get him calmed back down after that. Please don't come in this house bringing something like a train. I have to hide all those things because he will never let it go once he's seen it." So listen for those kinds of reports, because those are super, super important when we're looking at this emotional regulation or this area of temperament. Another marker here is consistent marked difficulty with transition. So it is so hard to get a child to move on to something new. And we certainly see that in therapy. Again, I just use that example of once you introduce something they like, it's very, very hard to remove it from them so that you can do something else. And the same can be true from activity to activity during the day. It may take a mom forever to get her child in the bathtub, but then once he's there, she can't get him out. Or he may not want to leave to get in the van to go wherever they're going. But again, once they've arrived at their destination, he is fighting with everything he has to stay in. So you have to look at that difficulty with transitions. Does it happen a couple of times a day, like it might happen for all toddlers and even our little friends with language delays, or is it a big pattern of difficulty? Another thing here is called low positive anticipation. That means that you tell the child that you are about to do something that they absolutely love, but there's no reaction or very little reaction. And again, it's not because they don't necessarily they don't misunderstand what you're saying. They just don't have that eagerness, or again, that anticipation of what's about to happen. They don't get as excited. Their emotional response is completely different compared to children with typical development, and even including our little friends with just language delays. The last area here is so important. It's a higher level of activity. And again, this is compared to all toddlers and even toddlers with language delays. When you have a kid on your caseload that you just cannot get to settle down no matter what, we think about those as our sensory regulation kids, but remember, this falls in this same category. And children with autism have a much higher activity level on the whole as compared to our little friends with just language delays. So think about your patterns here. You may see these kinds of things, difficulty with transitions, or kids who have short attention spans in our little friends with just language delays, but they're going to be much more consistently noted in children with autism. Now, don't forget, when kids are sick or hungry or sleepy, all of us fall apart during those times of physical need or physical dysregulation. But as a whole, when we see these big differences here, lean toward autism as your diagnosis rather than language delay. Another very important developmental difference here noted in all these areas from the Mitchell study is that kids with language delays are making consistent improvements at really important markers, 12 months, 18 months, and 24 months. And know that that's with or without intervention. Now, for us, those of us who are therapists, we think, well, no, they're going to do much, much better with intervention, and of course they are, and that's not what I'm saying. I'm just saying that we look at progress here. So when we have children who are making very steady progress, or parents might say, you see them at 24 months and they say, well, actually, he is saying more than he did a few months ago. You're still noting that progress there. Kids with autism will plateau and just stay at the same level for a long time. And again, that's both with and without intervention. Lots of times kids with autism even regress or decline. So a parent may say something like, you know, he used to really say 5 or 6 words and now I don't hear anything. Or we taught him how to wave when he was like 10 months old and now I cannot get him to wave at all. So that's a big red marker. It's also important because when we're thinking about language development as a whole, 12 to 24 months is a critical period for toddlers with language acquisition. We usually talk about children having their language explosion during this time. So when a child is not doing that, when we don't see any difference in his skill level at 12 months versus his skill level at 24 months, we know that there's something more going on than language delay. To summarize in a nutshell here, toddlers with autism demonstrate significant differences in all these areas, and much more so than our little friends with language delay. In the social area, kids with autism struggle more with social interaction than kids do with language delays. In communication, kids with autism will have those atypical things that we see, echolalia, rote language, excessive jargon, those unusual vocalizations, and kids with language delay do not. Kids with autism may also have that real atypical pattern where their expressive skills exceed their receptive skills. And again, remember how different that pattern is. Kids with autism will have atypical behaviors like body posturing. So our little toe walkers, our hand flappers, those are their motor skill differences. Kids with language delays, and if it's only a language delay, won't have any motor delays at all. And certainly if there's a global developmental delay, we're just going to look at those missing skills, not that there are these extra atypical things present. Atypical object use was our next category. So kids with autism will do some different things, lining up, spinning. Their play skills are usually significantly different than what we see with our kids with just language delay. And that last area with temperament or emotional regulation, anytime we see those extremes, kids are either too flat or overly responsive, and we see those big wild swings, and parents talk about, I can't get them to ever settle down. That, again, is a big indicator for autism. So to pull all of this information together for you, remember I promised that I want this to be practical and concrete and something you can use so quickly at the very beginning to help you feel better about your own clinical skills there. I've compiled this into a list of 7 characteristics that differentiate children with language delay versus those who are at most risk for autism. And let's review that now. And they're really simple things to look for. And let me tell you, you can get this in handout form at my website, and I'll tell you a little bit more about that in a minute. But don't struggle to write it down because you can get it all printed for you. But the first one was eye contact or eye gaze. These are kids who have difficulty paying attention to faces and following your point. That's the joint attention piece. When you say, Logan, look, he should be turning and looking. Children with language delays will do that. Kids with autism probably won't. So that's your biggest thing. You can test that right away within the first couple of minutes that you meet a child. Orienting to his own name or her own name. Inconsistent responding to your own name is just one of the big markers for autism in toddlers. And we want children doing that, responding to their own names by 12 months. And certainly our little friends with language delays, even when there are receptive language delays, they are doing that much more consistently than our friends who will go on to be diagnosed with autism. The next practical indicator that you can look for is pointing to or showing objects of interest. And remember, that falls in that nonverbal communication realm. So these are kids who don't point and who don't bring you things and show you things by 15 months. That's when we typically see that behavior emerge. Move on to the next one, our fourth characteristic here. This is pretend play. These are kids who do not demonstrate how familiar objects are used by 15 to 18 months, and they don't show true pretending with toys after 24 months. So those kids, again, are more at risk for autism than our friends with language delay. The next one is imitation. This, again, is a big part of that social referencing piece that we talked about. When kids don't pay attention to other people, they're naturally not going to imitate as often. So that imitation piece is going to be significantly impacted. You may not see imitation at all with a toddler who goes on to be diagnosed with autism. Nonverbal communication, remember that one piece that I said if you don't retain anything else from this course, retain this? That was gesture use. So kids certainly with gestures, they're not using a variety of gestures by 16 months. They also may have those things that we talked about in the temperament category here. This is overlapping. So they're flat or expressionless. And again, that's that nonverbal communication piece. And they aren't as aware of your nonverbal communication too. And the last one here was our language development category. These are kids that have delays and differences in both language comprehension and expression as compared to their same age peers. So there are, again, bigger gaps. The expressive skills may certainly exceed their receptive skills, and those are the kids that are most likely to go on to be diagnosed with autism. So those are 7 things that you can identify pretty easily, even through just a short parental interview that kind of let you know right away where your child is falling. And so I love this checklist. It's super easy, super simple. And again, remember, this is not a diagnostic tool. This is just a screening piece of information that you can use. And I do want to include this as a bonus for you for taking the CEU course. You can get this list in handout form, and you can download it for free at my website, which is teachmetotalk.com. Click the link below and it'll take you straight there. But if you just want to go to the website, look for the post that is titled 7 Characteristics that Differentiate Autism from Other Language Delays. It's also important that you get that age range there for you as therapist so that you can compare typical milestone development with those 7 areas that we just talked about. So be sure to get that link below. Now, if you would like more in-depth information about recognizing and treating autism in toddlers and early preschoolers, I can help you with that too. As I mentioned at the beginning, this information is not directly included in this course, Is It Autism? Recognizing and Treating Toddlers and Preschoolers with Red Flags for ASD, but it's pulled from there. So it's not the same information, but closely related. And I'd love for you to find out more information about that course. For speech language pathologists, it is ASHA approved, and it's on DVD, so it's convenient for you. And let me explain, it comes in 2 parts. Part 1 features information just about assessment. We walk through that official DSM-5 criteria, and the best part is there are videos. So when I'll say this is a characteristic of autism and you're not sure what that means, you'll see a video example of that too. Now, part 2 of this course is even better because it's all about intervention. You'll actually get a treatment plan with the 10 best initial treatment approaches to consider with toddlers for red flags for autism. And again, tons of video clips with my real little friends and kids that I've worked with and their families, so you can see that and get information about that course. Now, after finishing this course, I hope that you are much more able and feel much more comfortable about differentiating autism from language delay with kids on your own caseloads, and certainly as an SLP, and even in other disciplines. I hope that you can really use this information on a day-to-day basis to make a real difference for you. Please be sure to share this video with other therapists that you might work with. You know who needs it. So be sure that you're doing that. And even with your parents, parents may also benefit from this information. So when you have a parent who's asking lots of great questions, or they are just keeping Google lit up all day with their searches about their own child, this might be a great great source of information from them too, even if they don't need the CE credit. You as therapists do need the CE credit, and you can find out information about how to complete that process below there in the post. And to ensure that we get to continue to produce these $5 CEU presentations, be sure that you are subscribing to the channel so that you'll get notification every time a new one is posted. And you can also get new information about additional CE opportunities by being on my daily email list, and you do that by signing up at teachmetotalk.com. Just go to the website there and put your email address in the green banner, and then you are all set. All right, that's all for this time in this course. I'm Laura Mize, pediatric speech-language pathologist, and thanks so much for watching this special CEU presentation from teachmetotalk.com.